What measures can be taken to prevent the transmission of infectious diseases in a community or public health setting?
Well, we've certainly learned quite a lot about that during COVID, with public health measures being top of the agenda wherever you look. And there's some good learning we can take from what we learned during COVID. I think everybody's more interested in infection than they were before. That interest will wane, so I'm keen that we keep the interest levels high in infection and infection control. People, I think, are much more conscious of respiratory infection symptoms and how to manage those and how to be careful with those than they were before. And I think that's a good thing. But what we've certainly observed is that people are much less careful with other symptoms of infectious disease in a community setting, especially gastrointestinal diseases. So I think a key piece of advice in terms of preventing community transmission is look at what symptoms we have and manage those carefully. So if you have gastrointestinal infection with you and your family, it can spread very quickly. You can introduce it to other settings like schools and health and care settings. So follow the guidance. There's some really clear, sensible guidance from UKHSA about exclusion periods when we have gastrointestinal diseases, for example. So I think careful management of symptoms is one key bit of advice for people living in the community. I think people living in the community, that's all of us. We all live in the community. So wherever we work, they're all part of the community as well, aren't we? And I think the second major area that we can give advice is around hygiene. So looking after your hand hygiene, your personal hygiene in general, but especially if you're coming into hospital for a procedure, good personal hygiene is a way to reduce your infection risk.